Sign up to Council's disaster and weather event warning system. Receive alerts about emergency news, severe weather events and other public safety alerts via SMS or email. Registering to the disaster messaging system is free. To register, visit Gladstone Regional Council's Region Watch website and click on the Register for Warnings button. Get ready, Gladstone. Take the steps to protect what's most important to you. Let's be better prepared and protected for emergencies and disasters.
Well, good morning. The time being 9 a.m, I declare open the general meeting for the Gladstone Regional Council for the 15th of November 2022. Councillors, we have received an apology from Councillor Hanson, but a previous resolution has... Oh no, it hasn't been resolved. We need to resolve that today, sorry. So I'd like a mover that Councillor Hanson's apology be accepted, please. Thank you, Councillor O'Grady. Seconded, Councillor Branthwaite. All in favour? Motion's carried. Thank you. The next item on the agenda, councillors, is the messages of condolence. Do we have any messages of condolence? No messages of condolence. We'll move to the next item on the agenda, which is the prior notifications of conflicts of interest. Does any councillor have a prior notification of conflict of interest? Thank you. Over to you, Councillor Muscat.
In the item, because my computer's still opening. Hello. I, Councillor Natalia Muscat, declare, I'm not sure which conflict, but I would like to leave the room in the item that refers to the hookup events funding, which is...
Community Investment Program, 4.4.
Yes, that one, 4.4, as we are the QCWA Tandem Sons, I'm the president of, and we are expecting a donation from the hookup committee in relation to last year's, but we're still discussing that. So in light of that, I will leave the room. I realize that there's two items, or two separate events in that item. So I'm happy to leave from all of it unless someone was happy to split it. I'll be happy to discuss the yacht club one. I just can't discuss the hookup one.
Yeah, I'll split the motion when we get there, so you can remain in the room for the other one.
Thank you.
Councillors, any further notifications? I have two I'd like to declare today. So I, Mayor Matt Burnett, believe that it may be perceived that I have a conflict of interest in the Inland Rail project as a result of federal funding that was secured while I was a candidate for Flynn in the recent federal election. In anticipation of council at a future point having to make a decision in relation to the Inland Rail project, I'm declaring a declarable conflict of interest in the matter. Although I have a declarable conflict of interest, I believe it would be in the best interest of the public for me to participate in the decisions and that decisions relating to the Inland project for the following reasons. I'm confident of my ability to be able to make an unbiased decision that is in the public interest. Council's advocacy for the Inland Rail project, extending from either Toowoomba or Goondiwindi to Gladstone, commenced prior to me securing the federal funding. Any decisions related to the Inland Rail project will not impact me personally or any related party to the greater extent than any other member of the community. My knowledge of the Inland Rail project will assist Council to make the best decision in the public interest, and my participation in the decision in the Inland Rail project differs significantly to the Boyne Island Tandem Sands Aquatic Recreation Project, where in that instance, Council is the sole proponent, the planning authority, the landowner, in contrast to Council's role in the Inland Rail project, which is primarily as an advocate, which I have been for many years, and potentially as a future infrastructure provider. There are many other local governments and agencies that are involved in the project. I no longer have any influence over the allocation of federal funding. Notwithstanding that, I will respect the decision of my fellow councillors in relation to my further participation in this matter. Over to councillors.
Mr Mayor, before we proceed, not necessarily a point of order, but you're declaring two conflicts of interest today?
I am, but I'll deal with them separately.
You're going to deal with them absolutely separately. Okay, thanks.
Thank you, Councillor. Good luck.
Thank you, Mr Mayor. Appreciate your very transparent approach to this again, but I would like to move that the Mayor can participate in decisions around this matter unrestricted, that notwithstanding the Mayor's declarable conflict of interest with respect to the Inland Rail project, it is in the public interest for the Mayor to participate in this decision. I think the Inland Rail project's been something that has long been advocated for by this council. It's been a project on the books, I think, for about 103 years, has it? So long before you're ever a candidate in any federal election, and I've got no doubt that it'll be a great outcome for this community. And as you said, you've got extensive knowledge in it, and I think it's in the public interest for you to participate in any future decisions that we might have to consider.
Thank you, Councillor Goodluck. Oh, thank you. I got moved, Councillor Goodluck, second, and Councillor Branthwaite. Any further comments or questions?
I just wanted to get a point of clarification, Mayor Matt, before. In dot point 3 you indicated, in dot point 2 you indicated advocacy for the project before securing the federal funding. From my understanding, there was a commitment made in the forward estimates in relation to the $10 million for that study, so your advocacy was, and that was from the previous government, so your advocacy was with the change of government that would be ensured and locked in, enshrined in the budget.
Well, my advocacy actually was both. As the Mayor, I've been advocating for this project for many years, as Council we're well aware, it's in our strategic priorities document,
Yeah.
as is a number of projects, and advocated for the former government to secure money and the current government to secure money. Actually, at the time we announced the federal funding, it was pretty much 2 days after, I think, the Deputy Prime Minister, then Deputy Prime Minister, announced it. So it was on par. What I want to see now is that funding stay, and that business case is underway. So it doesn't matter. The funding is being spent because that is happening right now.
Yeah, no, I'm supportive of the resolution. I just
Yeah,
wanted to
it's
clarify that particular point, that it was already in the forward estimates
Yeah.
budget. Thank you.
Any further questions or comments, councillors? Councillor Muscat.
Thank you, Mr. Mayor. I just also want to point that this project is also in the priorities document of council, which we have all agreed as a council. So I think it's great that we have people that support those. So I'll support you staying and discussing and contributing to whatever it is that we talk about in relation to that project.
Thank you. Okay, no further comments or questions. Moved by Councillor Goodluck, seconded by Councillor Brentwaite. Rachel, do you have that for the minutes? All in favour? Motion's carried. Thank you, councillors. The next one is, I believe I may have a perceived conflict of interest in the Gladstone Basketball Association Incorporated proposed construction of a new facility within their current lease area. As a result, again, of federal funding that I secured for the project while I was a candidate for Flynn in the recent federal election, in anticipation of council as lessor and planning authority at a future point having to make a decision in relation to Gladstone Basketball's proposed new facility, I'm declaring a declarable conflict of interest in the matter, very similar to the last reasons. Happy to go into them if council would like. Councillors' thoughts on this one, please. I would say, do you want me to read through the reasons? Are you happy? Okay, let's go there. Although I have a declarable conflict of interest, I believe it would be in the public interest for me to participate in the decision that its decisions relating to Gladstone Basketball's proposed new facility for the following reasons. I'm confident in my ability to be able to make an unbiased decision in the public interest. Any decision relating to the proposed new facility will not impact me personally or any related party to the greater extent of any other member of the community. And my knowledge of the community will assist council make the best decision in the public interest. My participation in decisions to Gladstone Basketballs differ to Boyne Recreation Centre, where in that instance council is the sole proponent, the planning authority and landowner. In contrast, Gladstone Basketball Association is the proponent for their new facility, and council's role is limited to lessor and the planning authority. And I no longer have any influence over the allocation of the federal funding. Notwithstanding this, I respect council's decision of my fellow councillors in relation to my further participation in the matter. Over to you, council. Councillor Goodluck again. Or Councillor Branthwaite. I don't mind.
I was going to move, Mr Mayor, that you... Oh, sorry. Mr Mayor, thank you. I was going to move that you remain in the room for the item discussed.
Thank you, Councillor O'Grady. Are you seconding that? Questions, councillors?
I think it's probably more a matter of wording of the resolution from Councillor Branthwaite at this stage, notwithstanding the conflict of interest, rather than just simply stay in the room. I think if we just get the wording correct, no disrespect to you, Councillor Branthwaite, but if we just get the wording correct so we know exactly what we're voting on.
Like up on the screen?
Yeah. Get my glasses on.
I'm sure that's what Councillor Branthwaite intended to
Yeah, I
say.
just want to read it all. Yeah, notwithstanding the Mayor's declarable conflict of interest with respect to the Council's Gladstone's Basketball Association Incorporated proposed new facility, it is in the public interest for the Mayor to participate in the decision without restriction. I'd move that motion.
Thank you. Councillor Goodluck, question?
Happy to support that resolution, Mr Mayor, and Councillor Branthwaite. My understanding the commitment was to the Gladstone Basketball Association. It's not to council. Again, I appreciate the very transparent approach that you've taken with declaring this conflict. But in saying that, there's, whilst there might be someone who might perceive this to be a conflict, there's no real way to quantify, I think, in the public's view as to who would think that was a conflict. Some people may have appreciated that commitment. There might be many others that didn't appreciate the commitment. So there's no real way of quantifying it. So I do think that you're quite capable of making a decision that might come to this council in future in the best public interest, and I think you should participate without restriction. So happy to support that resolution, Councillor Branthwaite.
Thank you, Councillor Muscat.
Thank you. I just wanted to ask you whether you have any association with the management committee of the association?
I've met them a few times, but no, I have no association.
Okay. Now, well, I asked that question because it is clear in the legislation that there are some issues there that will restrict you from participating in the discussion, and none of those are your case. So I'll be more than happy to support.
Believe it or not, I wasn't quite the right height for basketball.
Oh, you can still help them in their committee and fundraising, etc. So.
I thought you were a ref, Mr. Mayor.
I could probably ref. Thank you, Councillor Trevor. Any further comments or questions, councillors? No. Thank you, Councillor Branthwaite and Councillor O'Grady. Moved and seconded. Put the motion as per on the screen. All in favour? Motion's carried. Thank you. That's it for my conflicts of interest for this morning. I'll move to the next item on the agenda, which is a Mayor's statement on current issues. Firstly, I'd like to start by mentioning the National Local Roads and Transport Congress held recently in Hobart, which I attended. Happened to be on the board meeting was on the day before the conference started, which was our council meeting day, which I unfortunately wasn't able to attend. Councillor Churchill was with me, but he was able to Zoom in. So very good program, and I know that Councillor Churchill has something he'd like to add in general business about the agenda, if not this meeting, the next one. Basically, obviously, speaking around about important issues for local governments in terms of local roads and transport.
Sorry to interrupt,
Yes.
Mayor Matt, but if I could also say something at the end of the meeting today, because I was sent away with an intent to attract the Congress for the future to the Gladstone region, and I'd like to comment on that later on.
Absolutely.
Thank
Happy
you.
to add to that comment too. Also, obviously, on the 11th, Remembrance Day services were held across the region and right across the country, and I thank councillors for attending. I believe we were able to attend all the services in the region. Obviously, very important Remembrance Day for Australia. Congratulations to the team for organising the Beer and Cider Festival on the weekend. I didn't make it, but I believe Darryl got dunked quite a few times. Just the once? Very good, Darryl. Thanks for being a good sport and being involved in that. It's a great community event, and well done to the team of volunteers who put that event on every year. And of course, yesterday we welcomed back our first cruise ship since before COVID, and the first cruise ship to dock at our new cruise terminal at East Shores. Very exciting, and I know that the team at GAPDL and our local visitor ambassadors did an amazing job welcoming our cruise ship visitors to the Gladstone region, the MS Nordham. Thank you for topping into Gladstone, and we hope to see many more cruise ships over the next few years. Coming up in the Gladstone region, we have the Rotary Charity Markets. They're this Sunday at the Botanic Gardens from 7 to 12. Of course, we've got the Santos GLNG Mayor's Carols on Friday the 2nd of December. There is a number of carols happening right across the region as well. The Phillip Street Communities and Families Precinct, great project, is finally celebrating his first birthday from 9 a.m. to 12 p.m. on Saturday the 3rd, directly after the carols, live entertainment, cultural performances, lawn games and free sausages, and of course a birthday cake for what is a fantastic project. And then in the main street on the 4th of December, we have the Christmas tree party where we will turn on the Christmas tree and we will welcome Santa, and I'm sure everyone will enjoy the markets there as well. And then to keep the kids entertained, the tickets are now on sale for the Festival of Summer, which starts on the 9th to the 13th of January. Just when they're getting bored, time to get them involved in Festival of Summer. Thank you, councillors. That's the Mayor's statement on current issues. I'll move to the next item on the agenda, which is the confirmation of the minutes, G2.1, for the general meeting of the 1st of November 2022.
Happy to move, Mayor Matt, but just noting from your comment then earlier that in the minutes you indicated that you're an apology for the meeting, which is understandable, but I think it should also be identified that you were attending the National Local Roads and Transport Congress at that particular time. So I'm not quite sure whether they insert that into brackets or just simply put it on record.
I know it's on live stream now, so that's fine. I was actually in the board meeting at that point and re-elected as Vice President. So that was nice.
Congratulations.
Yeah. Thank you. Councillor Churchill, any further comments on the minutes? And I can have a mover, they be true and correct record, please. Moved, sorry you did. Councillor Churchill moved, seconded Councillor Trevor. All in favour? Motion's carried. Thank you. Can we now move to deputations, councillors? And we have a deputation from Central Queensland Rural Health, and we've got Sandra and Melanie here, and I will hand over to you for your deputation. Welcome, ladies.
Thank you, and thank you, councillors, for having us for this deputation. We're going to talk this morning about the process we've been undertaking in the last year to look at health services and the sustainability of health services and health workforce in Gladstone. So just get Mel to acknowledge country and
Yep, so I'd like to acknowledge the traditional custodians of the land on which we meet. So that's the Bailey, the Gurrang, and the Tarrabalang Bunda people, and pay our respect to elders both past and present.
Thank you. So about 12 months ago, May 2021, the Primary Health Network, so that's the Central Queensland Wide Bay Sunshine Coast Primary Health Network, approached us as a result of some workforce meetings that they'd been holding to look at primary healthcare workforce, particularly in the Gladstone area, and develop a plan for ensuring the sustainability of that workforce. So we looked at our first step on that process was to undertake a stakeholder meeting. So we met with general practices, we met with allied health, we met with hospital, radiology, council, and then brought everyone together to have a larger meeting, which I believe most of the councillors were at early last year, and looking at the health issues that came out from the community perspective in relationship to the Gladstone services. We then undertook a community survey, and so that community survey had about 500 responses. Some of them were very hard to read. I think the community has had some difficult interactions with health services, both access to health services and the timeliness of responses, the availability of services locally, and feeling that the services were not well connected. So they were responsible for finding their own way through the health system, which is not ideal. And so then we looked at tabling some of those issues. We pulled all of the issues together and held a co-design workshop to try and look at the responses. At that stage too, the PHN changed the way we were doing things and wanted us to do some formal literature reviews on general practice workforce and what had worked well, what hadn't worked in other areas. So we undertook that literature review. And then throughout that period, we've looked at collecting local data. We've been successful in collating the activity data for general practice, for the allied health services, and some Indigenous data through there, but we don't have the data specifically from Nullindoo. So we've had to sort of say, well, enough time, we need to get this process finished. So we've gone on with that. So what did we come up with? The result in this, and I apologise, this slide is busy, but it really encapsulates what needs to happen. So we looked at the issues, and the issue primarily was about access to health services. I can't even read that. So it was about greater access to health services. And then what were the overlaying factors that contribute to that lack of access to services? So was it primarily just a workforce issue? Were there other individual determinants within that workforce that was making it difficult to retain the workforce? What were the social determinants? And what were the environmental factors that were contributing to that lack of access to health services? And also the lack of integration between the health services was coming out as more and more of an issue. We then looked at the literature that was involved in that, and it became very clear from the literature and from the conversations that this issue would need a multi-intervention approach. There wasn't something that you could do to fix the problem. There wasn't one thing. There was a lot of contributing factors to why there was a lack of access to health services in the Gladstone area. And for that to be resolved permanently, it wasn't just a simple thing. So it wasn't just build a bigger hospital. It wasn't just pay the doctors more. There was other issues that needed to be permanently addressed to make the health services in Gladstone sustainable and therefore increase the access to health services. So some of those, and the biggest one was really about the integration and collaboration of services. There needed to be not the hospital does this GP small business does that, this allied health business does that. There needed to actually be a collaboration and conversation about how does that fit into the overall picture and how do we work better together. Alcohol and drug services better delivered in the hospital setting, or are they better delivered in primary care, and how do we work together to make that happen? There's a lack of access to allied health and aged care services. What levers can we all pull to make sure that those people get access to those services? And so we looked at the need for leadership and service planning. We need to establish that process that isn't evident anywhere else, really. Like, health services are historically very disjointed because of the way the Commonwealth funds part of health services and state funds another part of health services. General practices are small businesses, so they do what they need to do to survive, and the hospital system answers to the state government but doesn't really partner with primary care. And if you're going to improve health outcomes, you need to actually improve primary health care and access to services. So it's about how do you locally plan for that to happen? How do you plan at a state and national level for it to happen too? But for this council and this community, it's what's happening in Gladstone that was important to them. So then we looked at workforce, regional medical pathways. How do you employ people so that they want to stay? How do you have the flexible employment models so that a social worker can work in the hospital setting and in primary care, so the specialist can do private services and public services? There's some systems levers that need to change to make that happen. What makes people stay? Increased professional, social, community infrastructure. It's a good place to live, it's a good place to work, happy wife, happy life. You know, you need to look at the whole picture of what attracts people to a community, not just the job. They'll come for the job, they'll stay for the community. Multidisciplinary teamwork, practice support roles. GPs are very much GPs practicing on their own sometimes. It's that multidisciplinary team, knowing that you've got allied health that will look after your patients, you've got specialists that you can escalate that patient to, and there's good relationships between all those parties. Professional networks, that's how you develop that relationship. If you put people in the same room, they'll talk to each other, and they might even be friends after they leave if you put them together often enough. Quality improvement, it's important that we have data and measure data. What's happening now? How's it better in 5 years' time? If we don't know what's happening now, how do we know that it's better in 5 years' time? And attraction incentives, promotion of Gladstone, and I'm sure that's something that it's at the forefront of the council's mind, but partnering with health services and health organisations to actually not need to reinvent what you're doing already. So if we do all of those things, what do we expect to happen? So we expect that there will be increased workforce capacity because there will be different opportunities for employment. People will come to the area. It'll be easier to attract because the best attractor is the grapevine, and if it's word of mouth that says come work in Gladstone, people will come and work in Gladstone. Student opportunities can't be underestimated. the places that are successfully recruiting now are the places that have that long look student model. So people are coming and working in the community, in the location as students. They're not coming for a week to have a look, they're coming for 3 months, 12-month placements and are becoming part of the team, and then they come back. Student numbers, even though CQU's here, the health discipline placements were very, very low. There are no real opportunities for any of the allied health or nursing placements. There's a few go to the hospital. There's a few postgraduate nurses go to the hospital, but that's the only place they go. So increasing that student access. There is the rural medical pathway now that CQU's operating, and there is an engagement on that. And since this process has started, the hospital's also developing intern placements that weren't there before, and there's intern placements in general practice. So there's a beginning recognition that you need to start and have access to the whole pipeline. You can't just have people leave high school and expect them to come back as qualified practitioners. You have to keep bringing them back into the community all the way through their training, or at least have opportunity to do that. GP with special interest models and rural generalist models are the type of shared workforce models that can be developed for medical, but also for allied health staff. Integration of services absolutely needs to happen. There needs to be regular networking. There needs to be increased professional development. Infrastructure is important. People won't come to a community if they don't have somewhere to practice and somewhere to live. And that's an area that council can get involved in advocating for, and making sure that there is student accommodation, there is specialist housing available, support and advocate for improvements to the hospital infrastructure, whether that's a level 4 hospital or one that's at least painted nicely. You know, it's degrees, but whatever degree, it needs to be attractive to recruit and retain the clinicians that come to town. And they need to be able to work in private and public. I think one of the things with Gladstone is that a lot of the push was for a big public system, but Gladstone actually needs a well-integrated public and private system. And with the MARTA closing, that's kind of not there anymore, but there is interest from the friendlies in Bundaberg, and not so much for inpatients, but for specialist surgery and day surgery. So having that partnership and advocating for those services is important. Just advocating for that innovative service delivery. I think council potentially has a role as the I don't know, honest broker, I suppose, of making sure that all of these conversations are happening and people are doing what they need to do. So we'll move on. So what did we find in the data that we looked at? So the disease prevalence highlighted cardiovascular, respiratory, mental illness, diabetes, stroke, cancer were all high compared to the national and state averages. Interestingly, a lot of those conditions are preventable, and hospital admissions are avoidable. So if you have a good primary care system, you have a good health promotion programs and healthy communities, you don't get as high a prevalence of mental illness or cardiovascular disease. Healthcare access, lack of access to GPs came out again and again and again and again. And sometimes it was tagged with the we need bulk billing services, but when we actually looked at the bulk billing access, there's no general practices that advertise we are totally bulk billing. There was one when we started, it's now no longer totally bulk billing. But in fact, some of those that are private billing do bulk bill, and they bulk bill the patients that need to be bulk billed. So there is some access to bulk billing for patients that are well engaged with their GPs. The patients that miss out are those that are not engaged with a long-term GP. They don't have that comprehensive primary care of a known doctor who treats them every time. And that's often the gap, and they're the patients that end up in ED. And ED is great for fixing one thing temporarily. And then you end up, when it's unfixed, you're back in there again, or when the next thing goes wrong, you're in there again. Whereas general practice is comprehensive care, good general practice, and that's the bit that's really missing. The support things that go around general practice and secondary care, specialists, mental health services. Yeah, so we had high wait lists, high costs for private consults, and travel outside the region. And I think travel outside the region is one thing that really could be easily reduced. There wasn't a lot of uptake of telehealth, and there is very few visiting specialists. So advocating for those services to come to Gladstone and then to also do their follow-ups by telehealth. One thing COVID showed us is that you know, a video Skype with anybody is okay in the right circumstances where you don't need to put hands on a patient. But more and more we see the systems going back to the way it used to be. It's much easier for the receptionist to organise face-to-face consults than it is to organise telehealth consults. So that's the default position. And so advocating for access for this community, both face-to-face and via telehealth, I think is important, but also working with the community to know that that telehealth service at the right time is quite appropriate. Workforce gaps, really there's workforce gaps everywhere. When we started there was an obstetric service. It only took, you know, the lack of 2 doctors to now there's no obstetric service. So it's very, very fragile, and there's not a lot of capacity to fill spaces in general practice or in allied health services or in specialist services or in hospital services. So to get a more robust service, we need more people with a diversity of skills. So you need more people with obstetric skills that can fill gaps in the roster. You need people who can work in general practice and in the hospital, and in primary care and in secondary care. So working to design an integrated health service that is fit for purpose for Gladstone. Underlying factors, I think we've talked about most of these already, so integration, lack of students. Professional networking is very important. People feel supported if they have colleagues around them. Infrastructure we've talked about. Burnout's very, very real, particularly amongst the general practice workforce. Poor Medicare rebates and financial incentives. I think some of it is also poor business models within general practice, and within the hospital setting, there's a lot of avoidable hospital admissions that could have been managed in primary care. So because people are in hospital more, it costs the state more to run the hospitals. They're always short of doctors. There's more expenditure. It's more expensive to treat people when they're acutely unwell than to treat them when they're not as sick. So solutions, collaboration, integration of services, student placements, flexible mixed models we've talked about, professional, social, community infrastructure, service planning and leadership, professional networks, multidisciplinary teamwork, attraction incentives. So all the same things again. So how do we make that happen? So we've done the plan, and essentially that's the end of our role at this point. So we've met with the steering committee. We've got a meeting with the HHS leadership group tomorrow, and we're also meeting with the PHN, and we'll be presenting this same information to them. We need to establish a health professionals network at a leadership level with the health professionals, so leaders in general practice, leaders in allied health, leaders from the hospital setting, about how to develop those professional networks and professional relationships. Needs to be a learning development group as well, which looks at professional development, but also university placements, registrars, students. There needs to be a culture of local leadership and collaborative service planning. So it's much easier to just say, this is my ivory tower and I'm going to stay in it and I'll just look after the services in my ivory tower and nobody else, that's all someone else's problem. The reality is that it's not. It never is. And unfortunately, we fund services so they stay in their ivory towers. Like, this is your job, you just do your job, and the Commonwealth will do that job or somebody else will do that job. Everything that happens interacts, and so you need to change the way that you think about planning for services so that that is an integrated planning process. And there needs to be advocacy from community and locally to encourage that to happen, to ask for that to happen. And that's where I would see council can ask some of those questions about that integrated service planning and potentially carry on an involvement with that. Again, it's about a cultural shift to integration of services, multidisciplinary teamwork, and not just a multidisciplinary team in the hospital, but a multidisciplinary team across primary and secondary care, so that there's relationships between primary care providers and secondary care providers, and some of them actually work in both. So that, you know, drug and alcohol services is a good example. They're often better delivered in general practice than in a hospital setting. And so how do we make that happen? Specialist services don't need to be provided in a hospital. They can be provided in a primary care sector or in a community setting. So it's about having that conversation and enabling those clinicians to work together, but also making sure that access to care is there for the patients. Increased professional development, student opportunities. So your professional development is what keeps you clinicians. They feel that they've got a career pathway, they're able to develop professionally, that's retention. Student opportunities, people learn from teaching and they develop as clinicians from having students, but it's students will go to where they feel they can learn and develop their careers. So if you have that constant learning pipeline for clinicians, then you will develop your next lot of workforce. Underlying all of that is increased professional, social, community infrastructure to support health professionals. Like having things in the community that they need. Childcare, recreation, housing, healthcare. They're the things that make a community attractive. So that's the end of our presentation. I'm very happy to have questions. what floating around is a very big document. That is the health plan. That's the little version. There's a big one somewhere with the same cover.
That's just action tables.
That's
There is a big one. That might be it.
That's
it.
that's the big one. That doesn't have the appendices on it. So there is a lot of information in there that needs to be picked up and used. The shorter version has the executive summary in it and the action tables. So things that need to be the short-term goals, medium-term goals, outcomes in there, but they all need to be picked up and actioned by a leadership group. Under each of the areas, we've put nominated leadership groups in there. A lot of it is led by the health professionals themselves. There's a couple in there that's got Gladstone Regional Council on it, but I think they're only the infrastructure ones and community ones. But that's something that perhaps, you want to have a look at in more detail and go, well, in next year's council planning, how do we go about making sure that these actions are implemented? Workforce is a problem that you can't fix quickly, long term. You can dump a few locums in there and you can fix it for now, but the locums just leave. What you want is a permanent, sustainable workforce model. That means you need your training solutions, you need integrated workforce, you need a good, attractive place to come to. So the plan is about long-term workforce solutions, not quick fixes.
Thank you. Councillor Muscat, you're involved in this process. Would you mind throw to you first?
Yeah, thank you. Yes, I was with Councillor Hanson. We co-chair a lot of the sort of leading group that looked at all this work. So we didn't really do much, to be honest, but we just showed up every time and had some difficult conversations along the way. Obviously, the sector is quite diverse. There's, as you rightly said before, there's lots of people that work in lots of different areas within the health sector. So I thank you for what you've done. It was a long but steady, activity, and I think there is a lot of information here, even though obviously we knew a lot of these things, but we haven't actually condensed that into a document and a plan that now we can use to further advocate for more services or more coordination of services. Look, there's not much more that I can say, but I was just looking, and I think today, the fact that you came today, I don't think we arranged it that way, but it's probably the universe telling us, because we're also presenting the economy transition roadmap, and it talks a lot about health services and other support services, and it again clearly calls for us as council to lead some sort of advocacy pathway to make sure that we support the changes that are coming and our communities can come in the journey. So I guess as a question, and I'm thinking maybe lots of us do, is like, where do we start? Because we probably are a little bit tired of talking, but we just want to do. And people need the doing, and things aren't not really getting any better, but in fact they're getting worse. You just mentioned, we hardly had any bulk billing doctors. We have none at the moment, and there is although there is some hope in some places, like the Frontley Hospital showing interest in our area. We met with them last week and it was really positive. So, but yeah. The implementation is going to be what is going to make a difference.
I think I'd like to thank Councillor Muscat and Councillor Hanson for their involvement. Having council involved in these sorts of activities gives it that community ownership. And I think for you as a council, it's about becoming familiar with some of the actions that are in the health plan and advocating for those actions to happen. Even if it's getting directly involved and saying we need the health leadership group to happen and, you know, meet 4 times a year to look at the outcomes of the plan and how integration's happening. I think health used to be something that is somebody else's job, like the hospital does that or your GP does that, but more and more the lack of health services is impacting communities so significantly that councils are having to get involved and make sure there's access to good, sustainable health services in their community, which unfortunately means a whole lot of learning for all of you, but also for the communities about how to navigate health services and advocate for their health services in their community.
I've got Councillor O'Grady and then Councillor Churchill with some questions.
Great, thank you, Mr Mayor. That was great, thank you. I just wanted to ask a few questions.
Yeah.
So was the Discovery Coast Community Reference Group involved in the
Do you want to answer
survey and with the Wide Bay Health?
Yeah, so I went to those meetings because I'm actually from the Discovery Coast myself. So yeah, I attended those meetings and certainly we promoted the survey. So the survey went out, we printed 30,000 flyers and it was distributed right across the region, including Discovery Coast. So yeah, the survey was well promoted down there. We did have some discussions with the Wide Bay Hospital and Health Service, but it is very hard with the Discovery Coast, as you know, because obviously down there we sit kind of in the middle. But yeah, our focus was on the CQ Hospital and Health Service for Gladstone. Yeah.
So are you doing any more presentations? Just there is a meeting tomorrow, which I do attend the meetings. So there is a meeting tomorrow. So is it okay to share this now data with them? Obviously it's public.
Yeah, are we okay to share now?
It is still in its final draft. It'll be public in about 3 weeks. We've just got to get the hospital to sign off on their data as well. So there's
Right.
nothing in there that they, you know, have great objection to. It's all public data, so it should all be fine.
Yeah. Okay.
But more than happy for you to share that it's coming out. And the solution's essentially the same for the Discovery Coast. It's that integration and support and
for sure.
public-private stuff.
Yeah. I suppose with the Discovery Coast, they're quite fortunate down there because they've got a choice to come to Gladstone or to go to Bundaberg. So, which is a great choice. I think, you know, better than others. And the other thing too with Bullion Healthcare as well was that they included with the healthcare centre out at Bullion.
The surveys went out to the Bullion community, to the Bullion postcode,
Right.
but we haven't actually met with the Bullion Health Centre at all.
Right. Okay. Yeah. Because I know that services have increased out there as well. So, which a lot of people don't know about. So.
They were advocating for a GP out there, and I believe they've got somebody visiting.
Yes,
now.
they do have the Medibus. Yeah.
From Calliope.
Yeah, from Calliope that do go and do skin checks and see doctors out there, so which is great. And the other question too I did have about, there was an announcement just in the last week or so about bulk billing and that they weren't going to, the government were going to stop the bulk billing. Does anybody know?
Sounds like a fairy tale to me.
Okay,
Yeah.
right.
Yeah,
Not heard that.
Okay.
You can't stop bulk billing.
Bulk billing is essentially Medicare is a payment to the patient. So the practice can elect to bill the patient and then the patient collects their rebate, or they send the rebate in on behalf of the patient and only claim the rebate.
Right. So that's where maybe
That's
the-
where it gets really
Yeah,
confusing,
yeah.
because, 20 years ago, the patient used to get the cheque and have to take the cheque in
Yeah.
and give the cheque to
Yeah.
the GP, whereas now you can claim that rebate on behalf of the patient, but not if you can't claim a gap. So the gap's illegal. You have to say the rebate's $50 and you want to charge $70, the patient has to pay you $70 and then claim the $50 back. Or you just claim the patient's $50 from Medicare.
Yeah.
And I think that that's something that isn't that well understood in the community, is that the Commonwealth Government should pay for my healthcare, whereas Medicare is actually the patient entitlement for healthcare, whether they pay a bit more than the bulk
Not
billing
less.
amount.
Yeah. No.
It's interesting, though.
Yeah,
We
it
should
is,
find
yes,
out more about that.
Yes, I
Yeah.
know. I heard it the other day and I thought, they were talking about it, and that's why I asked the question.
Yeah.
So, yeah,
So-
thank you for explaining that.
So some of the adverse media that you're hearing about the rorting of Medicare is where doctors may or may not be claiming too high a rebate back from Medicare on behalf of the patient without informing the patient.
As in saying they had a longer consultation, where it was a shorter one, and then they could fit more in 1 hour than they... Well, that's not very good.
Thank you for that.
Councillor Churchill, then Councillor Goodluck.
Thanks, Mehmet. Thanks, Sandra. And Mel, congratulations. Well done. I'm not sure whether your front page depicts storm clouds ahead or whether there's a ray of sunshine for the future. But I'd love to know who picked that out. Having spent the day in Gladstone Hospital yesterday, we just also need to be careful and cautious in our advocacy that we're not being critical. I know you're not, but we can't be critical of the people that are working in that professional environment, because those that are in there, in some areas perhaps a little bit overwhelmed, but the fact is that they're doing some marvellous work. They really are professionals at the best. So we need to recognise and be cognisant that the people that are in there at the moment, while we need more and we need a diversity, we need to make sure that those, especially in the messages that go out to media, albeit the media stories, that the people in there are doing great work. I want to raise a particular point, and you made the point about student opportunities. And my question in advance is, I wonder whether the public sector can develop the model from the private sector. I've raised this a couple of times. I'm a member of the CQ alumni, and at a graduation where I was a keynote speaker, there were 36 students from the CQ University graduating with a diploma of nursing. I took the time to ask them where their deployment would be, and their deployment was not here in Gladstone. You know, I think there was one that probably had a secured or near secured position within the Gladstone region. So that alone is an issue. And I asked the question, is there a way somehow that we used to do it really well in the past, is to be able to integrate those students within the school, within the hospital, from the schools, albeit from the university, so that they're getting that first-hand experience, building the team rapport, and not only that, but valuing the first-hand experience rather than just the theory.
Yeah. And I think that's the key, is that they need to come here as students and they need to work in the hospitals and the general practices and the aged care facilities here on their placements. And all too often their placements are tailored to the lecturer's convenience, not their convenience. So they'll do a 3-hour placement once a week. And so you're not going to come for a 3-hour placement in Gladstone, but it's how do we advocate with the universities to redesign their placements so that they can do a 3-week placement or a 6-week placement. And if they come and they build the relationships, then people are going to say to them, why don't you come back here and work next year? And their ease then into a job. Whereas if they don't come here as students, they go where they're familiar. They go somewhere they feel safe. And so I think that is a big step in, offering carrots of accommodation or carrots of good placement or holding the university to account for offering placements in Gladstone. And it's CQU is the main one, but UQ and Griffith also cover Gladstone, and there's no placements from them. Yeah. So I think it's an important thing that's missing. There is no accommodation for them if they come, but I'm sure that that's a solvable problem.
Thank you.
Councillor Goodluck.
Thanks, Mr Mayor. Just when you talk about bulk billing, and you rightly pointed out we don't have any bulk billing practices here. We have mixed billing practices, and one of the biggest issues I find with that is particularly people who might not have high incomes or a lot of disposable income, for example, walk into a general practice clinic not knowing whether or not they're going to have an $80 bill or a $90 bill after their consultation. And I reminded, a couple of years ago, my son, only young at the time, had a bad cough over the weekend. A lot of the practices, whilst they may bulk bill, mixed billing practices in our region, on weekends they won't, no matter who you are, no matter what level of income you are. And his cough got really, really bad, and by Sunday afternoon we decided to ring the doctor. It cost $90, I think, at the time to get my son into the doctor. I'm very fortunate. I had the $90 to pay, and we took him to the doctor. He got rushed straight up to hospital. He had pneumonia. He had 75% of his lungs full of fluid, and to the hospital's credit, they got him all sorted. He was okay. But I often think back in, what if it was a family who didn't have $90, who couldn't afford to take their son to the doctor on that Sunday and might have had to then wait till the following day? What ramifications might that have had for their child? So now, personally, I think the rebate structure is geared towards a high churn style environment, and we mentioned about doctors perhaps trying to manipulate the system. That also speaks to me around the fact that we haven't had any indexation in the rebate structure for many years from all sides of politics. My question is that something that perhaps the CQ Rural Health Group could work on around recommendations to the decision makers around that rebate structure, and whether or not we can perhaps get a better working system, maybe some reform or some tweaks, because we've been waiting a long time, decades, for any reform to come from the top down. Perhaps it needs to come from the ground up, because it works well perhaps for big cities, Brisbane, Melbourne, Sydney. It doesn't service regional areas, as you'd be well aware, where we thereby have no bulk billing centres. You have mixed billing centres, and people that can't afford it don't necessarily know whether they're going to get an $80 or $90 bill when they go and see their doctor.
Yeah, so there's a couple of things in that comment, is that nationally there's a lot of advocacy for making the rebates align with the type of work that's done, and there are other item numbers in there for doing health assessments, for doing procedures, for doing chronic disease management and plans for complex patients that do make it attractive to bulk bill those chronic complex patients that are unwell. And often the situation that you highlighted is the one that comes to the fore. It's the occasional health service user that can't get in. So the two groups that miss out a lot are your unwell, low socioeconomic people that are not engaged with a regular GP, and they just get sicker and sicker and end up in hospital, or your person that is unwell as a once-off, chest infection, infected cut, some sort of injury, some sort of illness that's a one-off illness, and they don't have a usual GP. So they've got to find somewhere to go to, which is parents' GP or a bulk billing centre or the emergency department. If they can get into that centre quickly, they can be treated early and are not as bad. So you would treat an infected cut rather than a cellulitis or major infection. You treat a chest infection and not a pneumonia. So it's partly about educating the public. It's partly about having access to urgent care, and the Commonwealth is looking at 50 urgent care centres that are GP urgent care bulk billing. I don't know where they're going to go. I don't know where they're going to find doctors to put in them. But it's that urgent care bit that is often missing, and because there's not enough GPs, there are very few spare appointments during the week. I've got a toothache, I've got a cold, I've got a stomach ache, I've got something that's likely to not be urgent if it's treated early. So some practices save on the day appointments for those patients to get in on a Friday and not on a Sunday. Others go, well, if I'm working Sunday, you need to pay me. So, I'm not sure that there's an easy answer to that. If there's more GPs, there's less competition, and there's more likelihood that they would bulk bill a longer consultation for that sort of thing, because the doctor would have had to arrange his transfer to the hospital, they would have had to organise x-rays, all that sort of thing. So it was a complicated appointment when he did get there.
Yeah, and I might just add, when we have a shortage of GPs, obviously then after-hours services are really hard to be able to get into and access. And in terms of the hospital and our Triage 5 category presentations, they are higher in Gladstone compared to Bundy and Rocky hospitals, and that's in comparison to a smaller LGA population. So that's really interesting. Triage 5 category presentations are those that are GP type presentations that can be seen in the GP setting. So it's really interesting that here in Gladstone we do have higher Triage 5 presentations than both Bundy and Rocky.
Probably because we have less bulk billing.
Yeah.
And the after hours
After-hours.
access as well is an issue. So, yeah.
That decreased temporarily when the super clinic was built at the Windmill Centre. It was an after-hours super clinic service.
Yeah.
I'm not sure what hours they operate now, but funded, thank you, Councillor Trevor. And I was on the health board at the time, and we saw a decrease in the level 5 presentations almost immediately, but not enough, because if you don't know how much an after-hours doctor is going to cost you on a Saturday or a Sunday, or at 5 or 6 o'clock or 7, and I think between 5 and 9 was the busiest time at the hospital, because people were injured or sick at that point, and there was nowhere to go. Then the super clinic opened. Dr. Bird was there at the time, and almost immediately we saw a decrease in presentations to the emergency department, but it's back there again. Councillor Cameron, question.
The Marna Hospital, what is that and what's it going to be?
I'm no authority on what it's being turned into, but some conversations are about it'll be theatre spaces, so they'll use the operating theatres in there. I'm not sure about day beds, and the consultation rooms will be specialist consultation rooms, public and or private, I'm not sure.
Yeah, well, this is indicative of the problem we got. We don't know.
Yeah.
And the public's been kept in the dark about it. And I think that with the bulk billing problem is the source of it all, because I think when the GP super clinics theory was put out there, I think there was a perception that this GP super clinic would be wholly bulk billed, where you can go present there. If you've got a problem, you can go down the line. They have certain pathologies and things they can do, so it's a one-stop shop, and it just hasn't turned out like that.
Yeah.
So yeah, that appears to be a mismanagement or a misalignment within the system.
So there's a couple of things there, is that this is about having local leadership around health services and having those conversations, so as councillors you do know what the intention is and what's going to happen for the health services in your community. And I think that needs to happen regardless. With super clinics and bulk billing, so the super clinics, when they were built, had a classification, a DPA classification, so that they could recruit doctors easily. that classification now covers most of Australia except for the inner cities, and so the super clinics are competing on an even playing field with everybody else, and they can't recruit doctors either. And so there's a lot of things. Remuneration is one of the things that's making general practice unattractive. Some of that is because of the business models that are operated in the general practices, and there's now a push to teach business in medical courses and allied health courses, so people actually are prepared and understand Medicare, because the perception is that doctors understand Medicare. I can tell you they don't. And so that's where you end up with some of the perhaps not the best model of billing Medicare that could be operated. Bulk billing is a patient rebate. It's not necessarily designed as full patient payment. And so it's then about the conversation with the community, of having that conversation with their doctor about being able to pay the $80 and get the $39.95 back, so that they're actually only paying $40 for that consultation, or going to a practice where their billing fees are $65 or $70 and they give a pensioner concession or a youth concession. So there are other billing models out there that recognise that, is that the Commonwealth contributes an amount of money for a consultation to support the patient.
Sorry, I lived on the Gold Coast for 10 years before I came to Gladstone. I never paid for a doctor's visit once, and that's because those...
The highest bulk billing suburb is Sydney North Shore. Yeah,
so it's all right for us to have the conversation with our community in regional Queensland about, Medicare's not designed to pay for your whole doctor's visit, you might have to chip in some. But that's not how it works in the cities. I remember the shock I had when I got my first doctor's bill when I visited a GP when I first came to Gladstone. I thought, what's going on here? This is not how it works. So the system is not equitable across, certainly for regional Queensland, as I'm sure you're aware, and I think there needs to be more of a look at how we can make it equitable.
Moving some of the doctors off the Gold Coast to somewhere where they're actually needed would be a really good idea.
More GPs just to increase the tendency to bulk bill.
Yeah,
and Sydney North Shore, geez.
Yeah, that's been, for the last 10 years, that's been the highest bulk billing per population ratio is Sydney North Shore. And if you look in, it's the more affluent suburbs that have a higher level of bulk billing, because there's more doctors live there.
Yeah.
And they attract the patients by bulk billing them, not always in accordance with the rules, but I'm not going there.
Okay, let's not do that. Councillors, any other questions? I'll share just a couple of little things that we're, as a local government, doing, and it's only one nurse, but it's an exciting start. A couple of years ago, we started a mayor's bursary to go to a local student from a local school that goes to attend Central Queensland University. And I was at Tallulah High Awards just recently, and it was pretty cool that a local student and a family very well known have, we don't pick them, the school and the university pick the students, is going into nursing with that bursary. So it's going to be a few years before that student finishes, but that's one, and that's at a local level. That's not really our core business, right, no, to do that. But you're right, one thing I've learned over the last 18 months, if you can train them locally, they will stay locally. Yes. And it's something you probably learn over the years, but you see it particularly in health. Yeah. And that's one, and we hope more will follow. And without going into too much detail, we did meet with the Friendlies just recently, and we will do whatever we can to help an organisation like them, not necessarily them, but like them, to establish in our region. Again, not local government core business, no, but we'll do what we need to, because that private health section or sector working with the public health sector is pretty much what you've just told us this morning is what's needed. So
yeah, and realistically, the private health insurance rate in Gladstone is near 60%. So yeah, people are wanting to be able to use that private health insurance as well. So we need to put the right people in the right place. And I think the real opportunity is that engagement with the private specialists, but then also having them do sessional work at the hospital. And that relationship between private and public and bringing them together, even if it's in a manufactured kind of way, that they get to know each other and work together better. With consultation spaces, because there's not enough GPs, most of your surgeries actually have spare consultation rooms and would happily house a specialist. So, yeah.
Okay. Yeah, Councillor Muscat and then Councillor Churchill as well.
Sorry, I was you mentioned the general practice models too, business models, and I also wanted to ask you, a few years ago we had those, a doctor that will go to your home. I can't remember their name exactly, but that was, and that person bulk bill at the time. Yeah, so is that something that's still around or used in different areas? That
it kind of fell away with COVID because most of those doctors it was based on a corporate model where the doctor was on a visa with that bulk billing model. Your bulk billing rates for home visits are significantly higher than bulk billing in a general practice. So if you work out your trip essentially so that it's fairly cost effective in time, then you can see patients in their own home. To a degree, you never quite have everything that you would have in a doctor's surgery, but it was very good for patients that couldn't travel into the doctor, although it was starting to be, if you worked and you wanted your script filled, you just rang the after hours doctor and they came round and gave you the script at 6 o'clock at night. So, yeah.
Councillor Churchill.
No, I'm happy to move that the deputation today from the Central Queensland Rural Health be received.
Thank you, Councillor Churchill. Seconder, please. Councillor Cameron. No further questions. Put the motion. All in favour, and it's carried. Thank you, Sandra. Thank you, Mel.
Thank you.
That's fantastic. And anyone who didn't know much about Central Queensland Health, they certainly do now. Thank you.
Well, and anything we can do to help in the future, let us know.
Thanks, councillors. We'll move. I'm going to hold item 4.1 till towards the end of the meeting, and we'll move to G 4.2, which is our annual report. And I'll hand over to the General Manager Strategy and Transformation Acting, Sarah Hunter. Excellent. Over to you, Sarah.
Thank you, Mr Mayor. Good morning, councillors. Today I'm very proud to present to you our annual report for the 2021-22 financial year. The annual report is our primary report to the community documenting our progress and achievements, challenges and highlights over the 2021-22 financial year. The report also includes our final audited financial statements as audited by the Queensland Audit Office. And I'm proud to say this year our theme was collective delivery. The annual report features many community stories that reflect this year's theme, with numerous examples of council working together with our community, with businesses, industries, agencies and our internal stakeholders to meet our community's needs. I would like to highlight, councillors, that there was 2 errors on the cover report. The total consolidated operating expenditure in 2021-22 was $215.5 million, not $217.3 million. And also the materials and services for our operational maintenance works was $92.8 million, not $94.5 million. Some highlights for the 2021-22 year that I'd like to highlight for you. 341,906 library books were borrowed. We had 20,009 tonnes of curbside rubbish picked up. We had 725 visits to our landfills and transfer station, which was an increase of approximately 140,000 from the year before. We repaired over 1,000 potholes. We had 123,667 customer service interactions. We had 1,211 development applications approved. We had 97,643 patrons welcomed at our Gladstone Entertainment and Convention Centre. And we had, surprisingly, 239,000 cybersecurity threats blocked. Our performance for our operational plan for 2021-22, which is featured on pages 96 to 131. Last year we delivered 10 out of our 14 operational plan initiatives, progressing our operational plan to 71%. There was some challenges last year experienced by our teams, which was impacts from COVID and high turnover, which presented some delivery challenges, but we are well on the way to finishing those outstanding operational plan items. Our financial performance for 2021-22, Council funded $50.5 million capital works program. We had a total consolidated operating expenditure of $215.5 million, which included $69.7 million of employee benefits, $92.8 million of materials and services, $3.4 million of financial costs, and $49.7 million of depreciation. We had a total consolidated operating revenue of $210 million, which included $158.4 million generated from rates and charges, $23.9 million from fees and charges, $26.9 million from state and federal funding. We had 8.6 from the state government entity income tax equivalents, and we had 10 million from other sources. This year, Council did record an operating deficit for the financial year, but we are actively managing that through ongoing financial sustainability work. And we're ensuring that we return our budget back to a surplus. From here, there is a communications campaign that we are wanting to roll out, and that will include making the document available on the website, Facebook and LinkedIn, ongoing promotions, and a 60-second highlight video which we'd like to share with you now. Sorry, we just need to wait for Pablo to switch over.
Financial year was The theme for the 2021-22 financial year was collective delivery. There are many examples of Council working together with our communities, businesses, industries and agencies, as well as internally to meet our community's needs. Our focus on the economy has never been stronger, with the launch of our economic development strategy and advocating for investment in hydrogen, aluminium and hydropower industries. In August, we collaborated with multiple stakeholders to open the Phillip Street Communities and Families Precinct. Over the whole year, we funded a $50.5 million capital works program which saw roads, water, sewerage and other essential community infrastructure delivered, while managing and maintaining $2.7 billion worth of assets for the region. The financial challenges of inflation and supply chain pressures impacted our costs, and reviewing our long-term financial sustainability over the next year is a key focus for Council. We are proud to have delivered over 50 quality core services to the community. To learn more about what we've achieved and delivered for the Gladstone region, visit www.gladstone.qld.gov.au.
Nice work, Sarah, Kate, and Jess. Who put that together? What, Darren and Matt?
It was done internally, so very grateful for our skills that we have in our brand and communications team, and fully acknowledge the work that's gone in from many different sources within the organisation to build our annual report this
Who
year.
was fishing? Oh, a couple of weeks ago? No, I was going to say, I don't remember that.
Why is that up there?
Any questions for the team, councillors? Councillor Goodluck? Oh. You don't get away that easy, surely. All right. Move Councillor Goodluck. Seconded Councillor Braithwaite. Councillor Muscat, did you have a question? No?
No, not a question. I just wanted to thank you again anyway. There was, I think I did say the same thing last year when we had this, but I really encourage everyone to read it. Those ones out in the community that want to know more, and sometimes people say, oh, what do I get for my rates? What do council do for me? We do a lot. Well, you guys do a lot, so, and I thank you for that, so.
And to our two regulars in the gallery, Tex and John, we have a copy for you. You've got one, excellent.
Actually, it's going to take a couple of weeks to be available, is that? Oh, okay, I thought I read that it was going to be
It's
available.
going to be available straight after.
Okay, great.
After it's adopted.
Okay, perfect, thank you.
Councillor Churchill, do you have?
No, it was a quick question, and Councillor Muscat referred to it, getting everybody to read it and understand it, but will you be nominating it for any award that might be appropriate?
This year we've decided to hold off on applying for awards. Last year we were very fortunate and got ourselves a silver award in the Australian Australasian Reporting Awards. We've used the same model, so and made some improvements based on last year's report, but it wasn't our key focus. Our key focus this year was to share the stories with our community of what value they get from our council.
Yeah, no, terrific. Good to take a break and go for gold next year, eh? Thank you.
Platinum. Excellent. All right. Well done, ladies. We have a mover and a seconder. All in favour? Motion's carried. Thank you.
Thank you, Mr. Mayor.
Well done. We'll move to the next item on the agenda, which is G4.3, which is the 2022-23 Operational Plan Q1 report. And back to you, Sarah.
Thank you, Mr. Mayor. So today we're reporting on the first quarter of the 2022-23 operational plan and the progress between July and September. Council adopted 8 initiatives across our 5 corporate plan goals, and all 8 initiatives, I'm pleased to report, are progressing on track. And at this stage, all projects should be delivered on or before the 30th of June 2022. At the moment, our initiatives are reporting that an average progress of 18%. I'd also like to highlight some of our core services and improvements that were delivered throughout this quarter, because we had a very busy quarter. So this quarter we delivered another standout luminous event with our community. We had 25,000 residents making their way to the gardens for 3 nights of lights, arts and display fun. We successfully delivered over $13 million worth of funding for future projects and initiatives across our region. On National Citizenship Day, we welcomed 97 citizens to our region. The Gladstone Regional Youth Council were supported to deliver their very first youth summit at the Phillip Street and Community Family Precinct in September. The second of 2 bridges was reopened to traffic in Lowmead. And the Glad to be in Gladstone website was launched. Some stats that I would love to share with you as well. Over this quarter, we had 8,777 visits to our community engagement platform, which is Conversations. We had 61,869 visitors to our libraries, which was an increase from last quarter. Last quarter we had 53,000 visitors, so an increase of about 10,000 visitors over the quarter. We had 43,877 customer solutions interactions, which was up nearly 20,000 from the quarter before. We repaired 522 potholes, which was up 96 from the quarter before. We had 1,500 page views to the council's grant funding finder. We had 60 appointments processed by our recruitment team. We had 350,000 social media interactions, and we had 240,000 website page views. We had 46,500 visits to our landfill and transfer stations, and we had 2,000 ICT service requests. So sharing the message from here, our primary communication after today is our annual report. We'll have a slight delay with our communications on our Q1 report, but we're going to share it through our website, promote it on our social medias, and we're going to share it internally so our people can also see the amazing work that we do for our region. And I'd like to table the report for Council's consideration.
Thanks, Sarah. Councillors, questions? All right, can I have a mover for the officer's recommendation? Thank you, Councillor O'Grady. Seconded, Councillor Cameron. Put the motion, all in favour. Motion is carried. Thanks, councillors. We'll break for morning tea.
Thank you.
Sign up to Council's disaster and weather event warning system. Receive alerts about emergency news, severe weather events and other public safety alerts via SMS or email. Registering to the disaster messaging system is free. To register, visit Gladstone Regional Council's Region Watch website and click on the Register for Warnings button. Get ready, Gladstone. Take the steps to protect what's most important to you. Let's be better prepared and protected for emergencies and disasters.
Gladstone Regional Council are committed to fostering a proud, involved and engaged community. The Gladstone Regional Council Community Investment Program provides financial support to local community initiatives, projects and events which promote community connections, regional enhancements, community celebrations and community education. For more information on the Community Investment Program, visit gladstone.qld.gov.au. Gladstone Regional Council. Connect, innovate, diversify.
Illegal dumping and littering is a concern across the Gladstone region, with over 134 offences in the last 18 months. Our region is beautiful, but there are a few bad apples that ruin it for the rest of us, and they need to clean up their act.
Commonly found items at illegal dumping sites across the region include car bodies and batteries, mattresses, tyres, white goods and furniture, and green waste. These items can be disposed of at any of the region's waste transfer stations, some of them even for free.
Illegal dumping and littering pollutes our environment, harms plants and animals, and detracts from the enjoyment of our public spaces. It can lead to stormwater and ocean pollution, with large amounts of plastic, sugar sachets, and cigarette butts caught in stormwater traps and grates.
It's cheaper for everyone to dispose of waste correctly. Illegal dumping and littering costs our ratepayers thousands of dollars each year in waste management and clean-up. It's also costly for our dumper, with penalties of up to $10,000.
We can all work together to keep our region beautiful and dispose of waste responsibly by placing rubbish in the bins, or even holding onto the rubbish until you're near a suitable bin, and using our local waste facilities. Don't be part of the problem of pollution. We want you to be a part of the solution.
From towns to the bush, illegal dumping and littering is everybody's responsibility. Protect our public spaces and natural environment by doing the right thing for today and tomorrow.
If you see illegal dumping,
Dob in a dumper.
See it,
report it, stop it.
Sign up to Council's disaster and weather event warning system. Receive alerts about emergency news, severe weather events and other public safety alerts via SMS or email. Registering to the disaster messaging system is free. To register, visit Gladstone Regional Council's Region Watch website and click on the Register for Warnings button. Get ready, Gladstone. Take the steps to protect what's most important to you. Let's be better prepared and protected for emergencies and disasters.
Gladstone Regional Council are committed to fostering a proud, involved and engaged community. The Gladstone Regional Council Community Investment Program provides financial support to local community initiatives, projects and events which promote community connections, regional enhancements, community celebrations and community education. For more information on the Community Investment Program, visit gladstone.qld.gov.au. Gladstone Regional Council. Connect, innovate, diversify.
Illegal dumping and littering is a concern across the Gladstone region, with over 134 offences in the last 18 months. Our region is beautiful, but there are a few bad apples that ruin it for the rest of us, and they need to clean up their act.
Commonly found items at illegal dumping sites across the region include car bodies and batteries, mattresses, tyres, white goods and furniture, and green waste. These items can be disposed of at any of the region's waste transfer stations, some of them even for free.
Illegal dumping and littering pollutes our environment, harms plants and animals, and detracts from the enjoyment of our public spaces. It can lead to stormwater and ocean pollution, with large amounts of plastic, sugar sachets, and cigarette butts caught in stormwater traps and grates.
It's cheaper for everyone to dispose of waste correctly. Illegal dumping and littering cost our ratepayers thousands of dollars each year in waste management and clean-up. It's also costly for our dumper, with penalties of up to $10,000.
We can all work together to keep our region beautiful and dispose of waste responsibly by placing rubbish in the bins, or even holding onto the rubbish until you're near a suitable bin, and using our local waste facilities. Don't be part of the problem of pollution. We want you to be a part of the solution.
From towns to the bush, illegal dumping and littering is everybody's responsibility. Protect our public spaces and natural environment by doing the right thing for today and tomorrow.
If you see illegal dumping,
Dob in a dumper.
See it,
report it, stop it.
Well, thank you, councillors, thank you, officers, and welcome back to those watching on live stream. We're up to item G 4.4, which is our Community Investment Program Signature Events Funding recommendation. And I have a request from Councillor Muscat to separate these two items, which I will put a motion that we separate them now.
I'm okay to leave for both, just if there was any.
Okay, well, I'm happy to have you in the room for the other one. I think you had an important comment to make. So
Before we do that, Mr Mayor, could
Yes.
I please, it dawned on me that I possibly have to declare a conflict. So the last year when we give the funding to the, was it the B2G Village funding? I was engaged at the time as a musician to perform at that event. Now, I'm not currently engaged to perform at any events over this period, but this is funding to promote essentially that event. So I've got to, because I've got a sitting conflict, I think I have to declare it. But I don't have any bias. I'm not engaged to provide any services here, so I don't believe I'm quite comfortable to stay in the room, be at the will of the councillors, but I think I should declare that.
Okay, happy for the conflict, councillor. Good luck. This is funding going to the Queensland Cruising Yacht Club for the live stream, which is not going to Eastern Gladstone, which is a separate funding pool. Kylie, have we already granted funding for Eastern Gladstone, or is that coming?
Councillors, Eastern Gladstone is something that council funds through its own business as usual. This is funding specifically for the live streaming of the yacht race. So.
Last year we must have given funding to the village, was it? Because I do.
We procure a service agreement between ourselves and Queensland Events to deliver the village for council.
So, and I acknowledge that this isn't that funding, but that is referenced all the way through the application. So just in the interest of transparency, that's why I'm declaring. But as I said, I am happy to stay in the room.
Okay. Councillors?
On a resolution?
I think so, yes, please.
Yeah, happy to move that Councillor Goodluck does not have a conflict of interest.
Well, that's not the... Where's tenure?
Give me the wording.
The wording is that
Should have
Councillor
been out of
Goodluck
the
can
room.
remain in the room. Is that correct? Oh, here we go.
Oh, yeah, no, we
Not-
tried that previously with Councillor Branthwaite. That didn't work.
Notwithstanding Councillor Goodluck's declarable conflict of interest with respect to Queensland Cruising Yacht Club's GPC 75th Brisbane Gladstone Yacht Race, it is in the public interest for Councillor Goodluck to participate in the decision without restriction.
And that is exactly what I was going to say.
That's what I thought.
Yep. The words are right out
I
of
just
my
checked
mouth.
with my lawyer friend over the left. Very happy with that.
Anyway, I'm prepared to move that.
Thank you. Seconder, please. Thank you, Councillor Branthwaite. All in favour? Motion's carried. Thank you.
Thank you.
Kylie?
Thank you, Mr Mayor, councillors. This morning I've got...
Oh, sorry. I have a procedural motion to split them. I'm going to move that we split the item into two, seconded by Councillor Goodluck. All in favour? Motion's carried. Thank you. We'll start with the yacht club, so you can stay in the room.
Thank you, Mr Mayor and councillors. This morning I've got Emily Costello, our Community Development Specialist, and Libby Catamol, our Community Investment Program Officer, online with us. Today we're discussing two signature events. The first one we will discuss will be the 75th Brisbane to Gladstone Yacht Race live streaming and pre-race promotion. The Council has funded this particular initiative for the past 4 years and beyond, and it is acknowledged that the standard of the live stream and promotion is high, with about 15,000 people worldwide engaged in the live stream. It is acknowledged that the additional request was to fund additional brand development and additional stakeholder engagement and additional marketing. The panel noted that the brand development is in place with a redesign embedded in 2019 and again in 2021, with the naming rights of the race transitioning to Gladstone Ports Corporation. In addition to the $66,000 for live streaming and race coverage previously invested, Council invests $20,000 on its own far-reaching marketing campaign and also partners with GAPDL, who invest a further $15,000 to ensure that this event contributes to the outcomes of the community development strategy. This particular application has been assessed on the criteria relevant to a signature event, which are overnight visitation, social cohesion and community pride, generating economic activity in the Gladstone region, financial sustainability, environmental sustainability, and enhancing profile and appeal of the Gladstone region. Whilst the application does definitely meet some of those criterion, it unfortunately doesn't meet all and therefore has a panel score of 57%. To ensure that we are continuing to manage our investment into the race and the overarching Eastern Gladstone destination event, the panel have recommended the investment of $66,000, which is our traditional investment, to maintain the coverage of the live stream and to complement the existing marketing strategies delivered by GRC and GAPDL. I invite any questions from councillors.
Thank you, Kylie. Questions, please? Councillor Churchill.
Yeah, thanks for that, Mayor Matt. It seems like history repeating itself. Hopefully there's a simple answer for it, because I remember last year in relation to the rating, and I've been through the assessment material, that I think their rating for their application was somewhere in the 70s, and I actually indicated that because of the significance of the project, it probably should be in the 80s or the 90s, but that's relevant to the project, not the application. But this year I note that they've actually gone down from, be it in the 70s, down into the 50s. So I think my question last year was two things. One was, how do we get them to elevate that up into the 70s or the 80s, be it? And my other question, and I suppose it's a regurgitation from last year, was, are we giving them the feedback that they need to know to determine appropriately how they can elevate their application to be able to reach a higher assessment percentage, please?
Thanks, Councillor Churchill. It's a really good question. No one's doubting the importance of this particular initiative as part of the overall Brisbane to Gladstone yacht race, it definitely is a very attractive piece of the overall event. As you know, we can only assess on what's in the application, and we do have regular communication with this particular applicant on ways to strengthen their application. I know Emily in the past has spent considerable time with the applicant around bolstering the application. We can only assess on what's in the application, unfortunately, Councillor Churchill.
I'm not questioning the assessment and I'm not questioning the assessors. It's just getting them to understand how they can produce the goods to ensure that they do get a greater outcome. Yeah. Anyway.
Councillor Muscat, then Councillor Branthwaite.
Thank you. I have to agree with Councillor Churchill. I read there's a couple of confidential attachments, and the assessment done by the assessment panel varied. So, and I think it needs to be more clear as to on how they answer the questions. It is really difficult for us right now, for me. I can only speak on my own behalf, obviously, but I don't, it's, it doesn't actually explain why there needs to be more money than last year. It doesn't explain a number of different things. And it makes it really difficult for us to support it based on the information that's in the application. So, and that is evident by the difference in the score and the low score. And sometimes we do need to add the previous knowledge that we have about the event, but that isn't the way in which we assess applications. So applications had to be assessed by the content that it's in the application, not by the feeling that I had last time I was there. So, and that's how we assess everyone's application and every other organisation's application. So, to be fair, I can see, I don't see how this could continue to be funded if the application is not improved.
Thank you for your feedback, Councillor Muscat. In relation to the reasoning through the for the increase of 20,000, it is additional further opportunities for stakeholder promotion and marketing leading up to the event, and brand development are the two reasons why. Hence my comment earlier around the contributing budget that Council has of 20,000, and also GAPDL's contribution of 15,000 for that marketing component.
Thank you. Councillor Branthwaite.
Thank you, Mr. Mayor. I'm sort of torn a bit because I fully get the fact that we're basing things on the material at hand, but I think we can't lose sight of the fact that this particular yacht race is in its 74th year. It's only 3 years younger than the City of Hobart. It's Queensland's blue ribbon, blue water sailing event, and here we're really trying to, and working with the Cruising Yacht Club of Queensland Cruising Yacht Club to promote the event by doing live stream. And I think the past 3 years, I think we're doing this 3 years now?
Oh, at least, maybe more, 4 or 5.
Maybe more?
I think one race didn't happen because of COVID.
Yeah. So, and on 3 occasions, I've actually seen this clips, not only the amount of people that are actually watching the event live stream, but also the actual content that's taken from that being broadcast on World on Water, which is a digital platform that goes right around the whole world. It's being played. It elevates our region for another reason, for a different sport and something that's quite steeped in history. I fully understand that the reasons behind the reduction from the application, but also I also get the reasons why they're actually asking for it, because the fact the brand recognition, we know what the Sydney Hobart brand looks like, we know what all these things, the Route de Rhum, which is a race on at the moment, which I watch live. It has come out of France, so I watch the America's Cup live. Watch all these prestigious yacht races live on the internet, and I have to say, it's just a great deal of pride that I watch our race being broadcast to the world live, and if we want to progress that quality and that coverage a lot better, falling short of bringing in a proper network for sponsorship and coverage, we certainly are needing to keep that progressing. But I do understand the reasons why the panel's made the decision, but I don't want to lose sight of the fact that this is a very prestigious yacht race. Thank you.
Thank you, Councillor Branthwaite. I don't think the panel's discounting the value that the actual event, the live streaming, has as far as the entire overarching yacht race. It's just stating that we would maintain funding at $66,000, which is what we've funded in the past.
Okay, any further questions, councillors? Do I have a mover for officer's recommendation or an alternative recommendation? So, split resolution, sorry, let's bring that up. Well, I'll scroll back. I was at the end of the report. Okay, well, the officer's recommendation can't be adopted as it is because we split the resolution. So here is officer's recommendation. Now that council adopt the panel recommendation for the application received under the categories funding below, Queensland Cruising Yacht Club for the 75th Brisbane to Gladstone, $66,000 is the panel recommendation. Do I have a mover for that? Thank you, Councillor O'Grady. Second, Councillor Branthwaite. Any further discussion? I'll put the motion. All in favour? Those against? Motion's carried. Thank you, councillors. We'll move to the next item, which Councillor Muscat has a conflict in, and we'll thank you, Kylie. Back to you.
Thank you. Now my mic's working, I'll start again. The second application we're discussing is the Boyne-Tanham hookup, of which has been assessed against the same 6 criteria and has received a result of 83%. The panel commentary includes a strong alignment to support the economic activity for the region and boosting community pride and cohesion. There's also the majority of the funding this year will be used to widen the marketing of the event. This isn't an initiative that council partners with the community to market, so the Boyne-Tanham hookup market this event themselves. And in addition, council does have an opportunity to foster some partnerships between GAPDL and the Boyne-Tanham hookup. Around fishing tourism and also for the Gladstone Healthy Harbour Partnership for environmental health initiatives. I invite any questions from councillors.
Thanks, Kylie. Councillors, questions?
Happy to move the recommendation, Member.
The new one on the screen?
Correct.
Which will be basically...
I don't have a conflict of interest, but I know a few of us have a real interest in catching the fish.
Yes, I'll just... I've got to move it, so I might just grab a second and then I'll go to Councillor Branthwaite for his question. Seconder, please. No seconder? Oh, yeah. Sorry, yes, Councillor Branthwaite. Oh, sorry, Councillor Cameron, happy to second. Okay. Councillor Branthwaite, question.
Thank you, Mr. Mayor. I know in the past that we've actually had an agreement over 3 years. I think it was $30,000 a year. And this event does amazing things in our community and amazing things for our lifestyle, demonstrating and showcasing what we have here. And it promotes environmental sustainability by tagging fish and releasing fish, and it records all those things. It does wonderful things for the Healthy Harbour Partnership, which I'm part of the management committee of. It's pretty cool. But to step up our funding by 20 grand, I'm just wondering what what the ratepayers are going to get for the extra 20 grand. You know, it's a very successful event, and I've got no doubt that it, you know, I love the fact that council are participating in it and flying the flag. For years, the past council hadn't. When I wasn't part of the whole thing, it was, you know, their participation was preparing the park and getting all that infrastructure ready, and now we've got all that, and now we're actually saying, no, we're actually part of this. But I'm just questioning what the $50,000, especially raising it by 20 grand, especially when it's it's an event that's quite successful in its fiscal management. And here we are asking all of the council to tighten our belts, and we're putting another $20,000 on top of that.
It's a really good question, Councillor Branthwaite, and I probably sound like a really broken record right now. So under the community investment policy and the panel assessment, we have to assess the application as it comes in. So the application.
So what if I went and asked for $100,000? Would you guys, if I met up with everything, would I get that approved? You know, it just. Yeah, I'm just sort of puzzled. I know there's limits to these things, but there's also, you know, in the past we've had their major events approval panel, and the things with that was building state sustainability and training people to uplift their events and more skilled and whatnot. And these guys, they know how to run a good event. There's no doubt about that. And it's I've got no trouble supporting the event, but I just question the level of lifting it by 20 grand.
I was trying to work out if you were moving an amendment. You were just mentioning they should have applied for 100,000. Was that the case?
Yeah. Councillor Churchill. And you were still happy to second,
Well, I'm happy to second, but I might be in conflict because I sort of agree with Darryl. A part of the assessment of these things is that they've got to display a sustainability. And if you can understand that a small ask because of inflationary pressures and whatever might be reasonable, but that's a substantial lift from what we have been promoting. So are they a sustainable movement? I believe they are, and I'm struggling to see where this extra 20,000 needs to go.
Sorry, Councillor Cameron. Sorry, I thought you had second. Would you like to not second that
Well,
motion?
I second it because no one else had a go, basically.
Well, you can second a motion and vote against it.
I realise that, but it just looks a little bit funny,
Yeah.
doesn't it?
Well, no, it doesn't. It gives us an opportunity to debate the item. Councillor O'Grady.
Yes.
Yeah, thank you, Mr. Mayor. I'm with Darryl and Chris, but I just wanted, like a few years ago when we did the 3 years thing, have they asked for that again to be? I'm just wondering why that didn't happen, because we knew exactly where we were going with the $30,000 in 3 years in a row. So why haven't they asked? Do you know?
I'm not sure as to why they haven't asked, Councillor O'Grady, but we can mention it to the committee if that's something that council wish to see, another multi-term. It does provide a lot of security, obviously, for the applicant, but it's also less administrative cost to council as well.
Yeah, totally agree. So thank you for that.
Yeah, is there any further questions or comments? Councillor Goodluck, and then Councillor Churchill.
Just looking through, what level of sponsorship does this 50,000 get, council? Sorry. I do recall some years ago, you know, we would sit here and debate about whether it was 12,000 or 14 or 15,000, and then it went to, I think it was 30,000 for 3 years, was it? 33,000. And notwithstanding, as everyone's mentioned, you know, the Hookup's a fantastic event. I think I saw in relation to our other signature events, does that then make the Hookup the highest funded event? No, with the exception of the live streaming and the, what else, sorry?
The highest funded event in this category is the Gladstone Harbour Festival at 100,000.
100,000, yeah. So second highest.
This is
Well, you
the
could,
third highest.
yeah, so Easter in Gladstone, then the hookup, yeah. Okay.
Councillor Churchill.
Yeah, thanks for that, Mayor Matt. I'm not sure I need much of a right of reply other than the fact that it adheres to policy. And that's where it fits in that assessment program. And they're not asking for a 3-year. They've been 30,000 for the past 3 years, so we started on that journey 30,000 3 years ago, and we've arrived. And I think my final comment is that we understand how much the cost of everything is happening out there in our community and the world as well. So I think trying to put that in perspective, if I reflect back 3 years, be it to 2018 when they went on that journey, I think the nature of products, the price of materials, services, and the list goes on, has increased quite dramatically in the marketplace since 2018. But I'll say it again, it adheres to policy under the assessment.
Okay. Councillors, any further questions? Okay, we do have a mover for the officer's recommendation, 50,000, and a seconder who may vote against it. But that's entirely, Councillor, good luck. Do you want to say something before I put the motion? Yes, there you go.
Sorry. So there's no limit on the signature events category as to what level of funding that you can apply for. So, and how many events, sorry, just to refresh my memory, do we have that usually get funded through this pool? There'll be...
About 4?
4 or 5, yeah.
Historically, we've had 2 through the signature event funding pool, and this would be elevating the hookup to the signature event category. It had previously been funded as an impact and destination event in the past.
Okay.
And so it fits with the signature event according to the
officer recommendation and the scoring, and the guidelines as per the assessment matrix of the score reaching that high within the recently adopted matrix, that would suggest why we're recommending full funding of the requested amount.
So what would be to stop other events then being elevated into the signature category, and then council having to consider next year an extra $1 million for our signature event funding because everyone wants...
The requirement to meet the key selection criteria of overnight visitation, economic impact and visitor attraction would mean that there are a number of smaller community events that just are not able to provide the evidence or the data to support an escalation into that category.
Thank you.
Thank you. Councillor Brantwaite. Sorry, Councillor Churchill.
There's no doubt that this event does attract a lot of people. Like I wear the badge with pride. You know, I'm part of that event. Well, I have been part of the event in the past, and it does attract a lot of people. I always just asking the question why we were actually elevating it to a $20,000 more. Like I actually get where Councillor Churchill's coming from. The expenses of running these things, it's very expensive to put an event, as you guys already know, and the costs have gone up dramatically. So, but I was just asking the question because it is a very financially successful event. That's all.
Sorry, Councillor Churchill, then good luck, and then I'm going to put the motion. Okay. Do you have a final comment?
Yeah, look, we all love the hookup. Hookup's amazing. We know, and they do have lots of data in the application, which is great. You can see the visitor attraction numbers, probably the most amount of data that I've seen in an application come through. I am conscious of the fact that we've gone in the past 4 years from $12,000 or $15,000 to now $50,000 a year, and I guess I'll take Councillor Churchill's point that that's reflective of the fact that we've changed the funding models and it scores appropriately on the criteria of the funding model. So I'm happy to support it today. But, good work, hookup, but we probably need to make sure we that is a substantial increase over that period of time. Thank you.
Would you like to hold your right of reply, or would you like to still speak?
No, I'd like to peak now if you can.
Okay. And then I'm going to
Or
vote.
speak or peak, it doesn't matter. Perhaps the Queensland Cruising Yacht Club could learn from the application from the Boyne-Tanham hookup in relation to their information. But I think what is timely today is that the Boyne-Tanham hookup effectively today becomes a region's signature event, which it hasn't been. It's now a signature event if this was to be successful. That's the first thing. And I suppose the second thing from my perspective is that just in understanding that they've provided all the information. This pains me a little bit too, because the extra $20,000 I'd love to see go on a missing link footpath somewhere around our region, but it's in the budget. So, thank you.
Okay, I have a mover and I have a seconder for the officer's recommendation, $50,000 for the Boyne-Tanham hookup. I'm going to put the motion now. All in favour? Those against? Motion is carried. Thank you, councillors. We'll ask Councillor Muscat to come back in the room. And I'm going to go back, considering time, to 4.4, which is, I'll wait till Councillor Muscat's in here. 4.1. Because time we might have to adjourn the meeting for the report. Sorry, Jess. Maybe. Okay, so councillors, we'll move to back to item 4.1, which is the Gladstone Region Economic Transition Roadmap. And I have that right here. Before Sarah starts her report, I would like to table this roadmap. It's we are going to launch this at the Entertainment Centre today at 12 o'clock, and I wanted to get this item on the agenda now rather than later, and so there's plenty of time for discussion, questions if necessary. So I'll table that report and I'll hand over to you, Sarah. Thank you.
Thank you, Mr Mayor. Today I'm very proud to present to you the Gladstone Region Economic Transition Roadmap 2022 to 2023. After many months of community and stakeholder engagement, data analysis and drafting of 2 reports, I'm very proud to present to you this report for endorsement. Our 2021-22 operational plan identified an initiative to develop a regional transition plan to secure a more diverse economy, and this roadmap completes our deliverable for this piece of work. The initiative has been delivered in partnership with our experienced consultants, The Next Economy, who specialise in regional economic development strategy. This project was also 50% funded by the Australian Government. The roadmap will inform and guide Council on what is required to support the Gladstone region to successfully adapt to a changing energy sector over the next decade, alongside other levels of government and industry. Due to the scale of change facing our region, the impacts on the economy, workers, and our communities, we know transition planning and coordination are vital for our future. I'd like to take this opportunity to recognise the significant efforts of the working group throughout the year. This project has been an outstanding example of collaboration and collective delivery between our Council's working group members from our economic development, brand and communications, development services, environment and conservation, engagement and partnerships, and strategy improvement, along with the consultants, The Next Economy, particularly their CEO, Dr. Amanda Carl, and Angela Heck, Program Director, who are here in the gallery today. Thank you. And I invite any comments from Council on the endorsement of this plan.
Thanks, Sarah. And I echo those comments. This is a fantastic report, and I'm really looking forward to launching this roadmap later today at the Gladstone Entertainment Convention Centre. And I also want to thank the Next Economy and the team, as well as our team here at Council, who have worked very hard. And this has been an ongoing effort for probably close to 2 years, but certainly at least 18 months, and escalated in the last 12 months. So I commend the report, and I'm happy to move the officer's recommendation, seconded by the Deputy Mayor. I will put it to Councillor Zoe for questions now. Councillor Muscat.
I don't have a question, but I have a comment.
Absolutely.
If I may. I guess I was just reflecting on the first time that I met Amanda and her team at the Next Economy a couple of years ago, and we definitely have come a long way. Even though it was a long time ago, I think it's gone quite fast. So for local government standards and government in general, we have arrived to a place now in a pretty good amount of time. So while it might seem long, it was not really long in local government and in the environment. So, and I guess when we first came to Amanda, and after all the discussions that we were having here, was we were a bit stuck on a bit of a limbo of kind of clear leadership in relation to energy policy and climate change. I'm happy to say that maybe we just untangled a little the last few months. So what we did actually back then, it was quite brave and courageous, I believe. And I'm really proud of the team and, well, my colleagues as well, and all of you, for having been brave enough to go into this exercise and leading this exercise, probably, leading the country in local government leadership as to how to deal with all the changes that we're going to see. So I guess my little bit of kind of personal thing is, like, I do have 2 kids, and they're young, and I also hope to have lots of grandkids. So, and I do I want them to live the best life possible. And I guess denying science and inevitable change isn't really an option. So for my kids or my community. So I'm really excited to have this now, and that our council has done this for everyone. So with the changes that are going to come soon, this, whether, we have a lot more chances of not leaving people behind. I don't know if it's going to be perfect, but at the end of the day, we're doing as much as we can. So I'm really, really happy, and thank you to the Mayor and my colleagues for going in this journey.
Thank you, Councillor Muscat. Councillor Churchill.
Oh, no, I'm fine, thanks. Well done.
Okay. No worries. Any further comments or questions, councillors? Councillor
Great to
Grady.
see we're leading the way.
We are. Gladstone Region leading the way. All right.
Thank you to Amanda and Angela as well. And we're going to miss you, obviously, over there, because it's been a very cosy last year and a half, I suppose. So, no, we're going to miss you, and hopefully we'll see you around. Thank you.
I have no doubt the next economy are going to be very busy with other local governments around the state and country after this report is endorsed, and the officer's recommendation, which has been moved and seconded by myself and Deputy Mayor, is that Council endorse the Gladstone Region Economic Transition Roadmap 2022-2032. All in favour? The motion is carried unanimously. Thank you, councillors. We'll move to the last item on the agenda, and thank you, Sarah, which is G4.6, the monthly financial report for the... 4.5. I was getting there. Cat and dogs. We've got to do the cats and dog trap hire first. 4.5, the amendment of fees and charges, cat and dog trap hire. Manager of Finance, Manager of Revenue Services, Elizabeth. Thank you. Well, let's just start, and then I think I've got to move it real quick.
Good morning, everybody. Just here to seek your endorsement of the extension of the cat and dog trap hire days to 14 days, please.
Thank you. Move Councillor Muscat, second, and Councillor Goodluck. Any questions or comments, councillors? Councillor O'Grady.
Thank you. I was just wondering, why haven't we made it any longer?
Why haven't we done what, sorry?
Why have we not made it any longer?
Yeah.
We could definitely take that up with the business units and bring that back to you. I'm sure about that.
Essentially, allows there's a bit of interest in these traps being hired out, so it allows that rotation.
Okay, right, okay, not a problem. Because I think we do have an issue in some parts of our region, so thank you.
Thank you.
Okay, thank you. We've done a mover in a second. All in favour?
We're not... Oh, sorry, Mr Mayor. I was just going to say we're not going to offer a bounty for the skins.
No, we're not.
No, all right. That's all right.
That was going really
Just
well.
delete that.
All in favour? Motion's carried. Thank you. Thank you, Liz.
Thank you.
Okay, next item on the agenda, which is the last item, sorry, which is 4.6, the monthly financial report for the period ending the 31st of October 2022. Thank you, Jess.
Thank you. Good morning.
I should say Systems Modelling and Matrix Specialist, Jessica Rosso.
Red's on. Red's on. Good. All right. In Mark's absence, just presenting the monthly financial report up to the end of October. So I just want to draw your attention to a few things that I've got here in the background of the report. The first being that we had our financial statements signed off during the month of October by QAO. So all of the comparatives in our financial report now are referring to the 21-22 financial year. I've also got a note in here regarding the decision that was made at the beginning of the year in this reporting to do with our rates revenue. So historically, when we raise our rates in around the August period, that's when you would see your 155 million hit your income in your profit and loss. And what we've noticed is that what that does is it leaves us in a really large surplus position for a really great portion of the year, and it detracts a little bit from the attention that we pay to the bottom line until we get further throughout the year. So recognising that rates and charges are to service a period of 12 months, what we've done is split that income evenly across the year, which matches it up a little better with the way that we spend our money here. So what you will notice, even though the rates due date has passed, our rates revenue is sitting at 41.6 million across a budget of 170.5 million, and that is simply because we've only unwound 4 months worth of that rates revenue so far.
Mm-hmm.
So
Unwound it, but it's in the bank.
it's in the bank. It's in the bank. A lot of it's in the bank. And it will continue to unwind until the end of the year when we'll be caught up and at that position for an entire annual cycle.
Jess, is that a new accounting standard, or is that just...
No, it's not in alignment with standards. It's something that we implemented in July as part of our finance team. So we spoke to the ARIC committee about it and just wanted to really make sure that when we were reporting, we were holding our focus where we needed it to be on the bottom line.
Okay. Thanks.
There won't be any difference by the time we hit end of financial year, and we'll be aligned. Our financial statements will always be comparable with the previous version. So going through the report, we've got our revenue, as mentioned, 24.4%. So the reason that we're still seeing a lag there when we're at about 33% throughout the year is because we've got a large amount of revenue to generate when we do our water meter readings. So we recognise our water consumption after we've done those reads because we don't have those figures at the moment. Discounts of 13 million have been applied for our payments received by the due date, and Elise shared with me this morning that we had about an 88% uptake of discount this year, which is really fantastic. Our interest revenue, so we're at 0.7 million against a budget of 1.3, 57.94%. So obviously in the challenging environment, there have been opportunities there for investment. So in October, we were paid 3.4% interest, whereas we had budgeted a much more conservative figure for interest revenue.
Sorry, that should just go up, shouldn't it?
Yeah, so when we do our next forecast, we will adjust for interest revenue there, which is good. Sales revenue is also above the pro-rata budget for the year, so we made some large claims throughout October for the Tannum Sands Road shared footpath. It is a recoverable project, so that sort of bonus income will also be seen down the bottom as expenditure. Income tax equivalents, you see that's still sitting at rounding down to nil. That is because the vast majority of that budget is our Gladstone Area Water Board dividend, which we don't see until much later in the financial year. Some notes there about our financial assistance grant and the allocations for 22-23. We've spoken about this one a few times, and we know that what we received was a little more than we were expecting, so we will be adjusting that up in the forecast as well. Capital grants revenue. So capital grants are recognised as the project milestones are met with those projects. That one is an accounting standard that came in about 2 years ago. So it's not necessarily that money hasn't been received in the bank for these projects. It's just that this is what we've been able to recognise so far in our financial statements. Anything that we haven't recognised but we have received in the bank will sit as a liability until we earn it. So there's a table there that details some of the major projects that have got big budgets or have had large receipts. Down to spending, so I said we were at 33% of our way through the year, and our recurrent expenditure is also at 33%, which is nice to see. We've got a little bit of excess in our employee benefits. There is an excess in overtime compared to our budget so far for this year, which is potentially coming from a high vacancy rate that we're seeing across the board and also difficulties in recruitment. So obviously there's a lot of essential work that's done here that needs to be picked up by someone somehow when we have those vacancies. Contractors and consultants are the other way, so there's a lag there at the moment with spending, It's not unusual for this time of year. We often see a lot of catch-up in our contractor and consulting bills at the end of financial year when our accruals are done. We do accrue for major expenses throughout the year, but there's a lot of parts of the business that are accessing contractors and consulting services on a small scale, so we can't pick them all up at the end of each month. Fuel is always the big one. Fuel and motor vehicle expenses, I'll speak to those together. Obviously, fuel prices have not come back down to where we were hoping they would at this point, so we will need to increase our fuel expenses in our forecast. Motor vehicle expenses is a similar story. We've got logistical issues with replacing our fleet, our supply chain issues there, so we are holding a lot of our plant and equipment for longer than we would have liked, and that means we've got increased repair expenses on those items. Staff and council associated expenses. We are lagging a little bit here, mostly in the training and development space, and as also in recruitment. So we are expecting the recruitment to kick back in once we start going out and trying to fill some of those roles, utilising some services. Down to the statement of financial position. So we've got a summary there of our year-to-date assets and our year-to-date liabilities. This will continue to move significantly between now and 30 June, which is what the budget is based off. So I've listed a few things there that will change these balances as we progress. Our cash will move as we incur our expenses and pay our loans. Our property, plant and equipment will increase as we deliver our capital program, and then it will decrease as it depreciates. Our unearned rates revenue, which is what I spoke about before, the remaining 8 months that I haven't put on the P&L yet, that will decrease as I unwind it. And our borrowings are going to go down as we make our loan repayments. Capital expenditure for the year to date is at 12 million against a budget of 51.4. We do have 13.4 million committed in open purchase orders in the system right now. 2.1 million of that relating to the Gladstone wastewater treatment plant distribution tower, 3.6 for the Stockbridge Road bridge renewal, and 1.8 million for Binderee Road investigation and design work. There is a table there that summarises our CapEx and the different groups across council, and a nice little S-curve graph. It's an artist interpretation of an S at the moment. Outstanding rates. This one's a good news story. I always like this graph. So you can see at the moment we're at 12.33% compared to 12.85% for the last year. And if you can see that graph, you can see this is the best that we have, the best position we've been in at this time of year. I did drop off another couple of years on this graph to make it a little more legible, but they were up as well. So we definitely need to commend the rates team on their recovery effort. Outstanding rates is a good news story. There's a few graphs there that speak through the outstanding rates and which areas they're in. Down to our sustainability ratios, these are the same ratios that we see month on month. Asset sustainability at the moment is similar to budget. You'll note that we aren't budgeting to hit the target 90% this year. It's due to the focus of our capital works program this year is not necessarily on renewals, but is on upgrade and new projects, which is something that we're expecting to see turn around in the future years. So it was in line with our long-term financial forecast. Interest coverage ratio, interest is a bit of a breeze now that we've restructured those loans with QTC. Our interest expense is very low now. Operating surplus ratio is indicative of the position that we're in so far. We've still got some major revenue sources to pick up on throughout the year, like our water consumption and our GORB dividend. Working capital and net financial liabilities. So you'll see I've presented those twice there. One to show the way that it appears on the balance sheet now, and one to show without the impact of that unearned rates revenue, just so you can see the difference there between how it looks when I've been playing with it and how it would look if I hadn't made that management reporting decision. And cash expenses, we're good. We've got a fair amount of cash following that rates due date. Happy to take any questions.
Thanks, Jess. I think you probably answered all the questions in that. But,
that was my plan.
Yeah, well done. Councillors, any questions? No? Moved Councillor Cameron, seconded Councillor Muscat. Put the motion, all in favour. It's carried. Thanks, Jess. Next item on the agenda is councillor reports. Councillor Churchill has a councillor report.
And just in relation to the earlier comment regarding the National Local Roads and Transport Congress that was held in Tasmania or Hobart recently, and I thank this council for making the decision to ensure that we sent one of our officers, Niels Kloppers, the manager for asset and infrastructure delivery, because as we all know, roads, footpaths, bridges, safe travel in our region is one of our core businesses as such. So there'll probably be a subsequent report come at a later time, but I wanted to raise one particular matter, and perhaps, Mayor Matt, you might be able to answer it, was that I believe at that particular time when the decision was made was not only to go to this Congress and represent the region and bring back information that would be beneficial to this council and to our region's residents and ratepayers, but another part of that intent of attending was to pitch for the Congress to be held in the Gladstone region sometime in the near future, perhaps next year or the year after. I've been to a number of these congresses around Australia, and they predominantly are held throughout the states of the nation. And when we talk about the importance of local roads, we do talk about the regions and rural areas. However, in my endeavours to line up the decision makers for the Congress to ensure that I could get into their ears to understand our pitch to host it here, and I believe that we ticked all the necessary boxes to be able to host that National Congress. The ELGA board, the Australian Local Government Association board, had a meeting just prior to the Congress, and I was informed when my efforts and endeavours to influence and advocate for our region was not necessarily dispelled, but I was cut down fairly quickly on the basis that the ELGA board made a decision that all future national local roads and transport Congress would be held in Canberra. And perhaps you as the ELGA board, but I'd just like to simply say that when we talk about roads and we talk about transport, there's nothing better than actually going out on these familiarisations to see, hear, smell, talk to the locals and get an understanding of what's happening in their areas. You know, so there's nothing better than seeing it firsthand, but obviously the decision makers have now decided that Canberra has all the challenges of local and rural roads and bridges and footpaths and transport, so the Congress will be held in Canberra from here on.
Not quite. Well,
Well, from what I'm led to believe,
yeah.
I have submitted a response in the survey and I've told them so.
So the recommendation, and I'm the Vice President of ELGA, and the recommendation was for it to be held in Canberra going forward because it's not only is it an important event, but it's also an event that if it's held at a right location, can generate an income for the board or income for ELGA as an entity. And so the recommendation was for it to be held in Canberra from going forward, but the board resolved to hold the next one in Canberra and review. So there is a chance that it could be held outside Canberra again. It all depends on how successful it is. It's also, you're hearing from some councils, like I've been to them in Mount Gambier. The Congress was in Mount Gambier. I went to one in Wagga Wagga. The cost of getting to those smaller communities was prohibitive for some councils to attend. Totally agree with you, Councillor Churchill. I was hoping that you would be able to lobby to get the Congress in Gladstone, but the board did decide that next year it will be in Canberra and then reviewed, and then depending on that review and how successful it is in Canberra as to whether it's rotated back into the regional areas, which has been for many, many years.
Yeah, thank you for that, Mayor Matt. But they tell me once you get into Canberra, it's very difficult to get out. So, but in light of saying that,
wasn't for me.
Oh dear Lord.
But in light of saying that, my key point, I think, is and I understand the logistics of holding these, but the Australian Local Government Association represents all states.
Yeah, all states and territories, and
territories. Thank you.
But the decision of the board was also to act in the best interest of ELGA, and having an event like that cost money. Maybe it might be easier to attract more sponsors and more registrations if it's in the capital. We'll see what next year brings. But
in
also,
the middle of winter. Thank you.
I don't know if it'll be in the middle of winter. That's when the National General Assembly is. So I doubt they'll have them at the same time. But it also, some other councils indicated the desire to be able to be during a sitting week, so they could meet with parliamentarians while they're there. So we'll see what happens next year, and if it's successful, it probably will be in Canberra going forward. But I can tell you, you weren't the only one disappointed. Victoria had already lined up to try and put it in a few regional cities in Victoria. But we didn't put his time. We didn't put his time to waste. He went round to every exhibitor there and told them that LGAQ conference is here next year, and they should get the sponsorship in now.
And that's a good point too, because with the economic development, there was a great presentation from the hydrogen and I suppose the energy vehicles. So hopefully Hyundai will be able to do that at the LGAQ conference here in Gladstone next year.
Yeah.
Be great.
Any further general business items, councillors? Before I close, I'd just like to mention that the expressions of expressions of interest are open for the 2023 Gladstone Region Youth Council. That's for our residents aged 15 to 24 interested in being part of our 2023 Gladstone Region Youth Council, and nominations close on the 4th of December. So, sorry? You just missed out, Councillor Muscat, yes. Only just. But if anyone's interested in nominating for that, please get your expression of interest in before the 4th of December. There's no urgent business, no notices of motion, no confidential items. I declare the meeting closed, 11:45 a.m. Thank you.